Okay, I'm starting with raising her leg up and just placing it on my knee to relax the entire hip flexor. It's placed at about a 90-degree angle. Going in from the side of her belly button, staying really close to the inside of the hip bone. Okay, so to hit this psoas, you've got to relax that entire leg. You could put it up on a really high pillow or something if you want to, but the key is to shorten that hip flexor and main iliopsoas. After I release that, I'm taking my thumb, it might be difficult for you to do, and kind of scooping in backward towards the iliacus, back of the hip, and I'm drawing that knee forward and feeling for it contracting under my thumb. Like I said, you can use your fingertips or even go to the other side and reach this way, but I'm kind of activating the leg to feel for any trigger points or any movement in that tissue that feels irregular. Sometimes you'll feel some dehydrated, tight areas just spasming, and then I release, extend it all the way out, coming back in, now with the leg fully straight, so the entire psoas is elongated, and I'm going in again from the side and working that tissue. From there, I'm going over and going into the TFL. Okay, that's the lateral part of the upper glute hip, however you'd like to say it, and just kind of palpating and doing a little bit of friction work or cross fiber work. This area can be super sensitive, so go really easy and gentle on this. The key is just kind of searching for any tight, sensitive areas. So after that, I'm just going to go along the quad region, and I'm using my thumbs. I use them quite a bit, but a lot of people can't. So you can use your forearm on this lateral aspect of the quad or knuckles. Okay. Now, as I'm going back in here, I'm bending the knee and going for that TFL again. Okay, that's that lateral hip tissue that I was hitting earlier, and I'm bending the knee, which is shortening those fibers up, and then I'm kind of like bringing it up and down a bit and feeling for anything in between, any of the tissues that are holding trigger points or tightness in between the fibers. It's best to move a joint or a leg around so you can actually hit different regions. It's not always easy in one position, so try that always, where you're kind of just articulating the leg in different areas or whatever area you're trying to address. Like I said, here I'm going for the TFL, and I'm going medial, lateral, straight, feeling for any restrictions, and going back in on that vastus lateralis upper region, as well as sticking with the same tissue. So now I'm going to go around to the other side. This will be hard to see, but I'm going to come back and finish up the hip flexor, and that is going for that iliacus movement, lateral hip. If you can't see this, but I'm scooping in on the inside of the hip with my thumb and drawing her knee toward me. And this is kind of making it easy for me to reach in and actually palpate that iliacus. Super sensitive on most people. So you just go real gentle. The pressure is really low. Just kind of communicating back and forth with your patient. But it's an awesome release. You feel really big differences after this. You notice I'm going in and out with that knee. So I'm moving that iliacus and having her contract and fire against my hand as well. Just getting some movement into that area. So, all right. So now we're going to go to treating the adductors. And I have her lay on her side. This is the best way to treat this. They feel the most comfortable, the patients. So have them lay on their side, extend the lower leg. That's the one we'll be treating. And the top leg, put it on a pillow and bend it about 90 degrees. Okay, put some lotion on. And all you're doing is gliding from the knee or midway in the thigh up towards the hip all the way to the groin area. I'm using my forearm here mostly. You can use your hands and thumbs as well, but the idea is just to glide up, hold pressure into those adductors right where they attach. It's a kind of uncomfortable area, but this is pretty comfortable position to be in for the patient, and you don't feel like you're exposing them too much. So Just make sure not to go too deep, just nice and easy. Glide up maybe 5 or 10 times in different strips, feeling for any restrictions. And from there, you can start working the attachments individually after you've completely released this tissue. So there it is. That's pretty much a full release of hip flexors, and this really helps that left ilium tightness or frontal rotation that's been created and kind of like shortens up this hip flexors and the adductors, TFL.